Hi, this is Dr. Allison Ankowitz, founder of Inner Dynamics Physical Therapy. Today I will be presenting to you management of pelvic organ prolapse. Hi, I'm Dr. Allison Ankowitz here to present to you our advanced wedge program specific for those with pelvic organ prolapse. This program targets not only the pelvic floor muscles, but also the lower abdominal muscles, otherwise known as the transverse abdominis. Just as a reminder, the pelvic organ prolapse consists of a drop of any one of our pelvic organs such as the bladder, the urethra, the uterus, or even the rectum. Increased tone to your lower abdominal muscles helps keep the pelvic organs in a more optimal position. This safe program promotes better bladder and bowel health. For those diagnosed with a pelvic organ prolapse, these exercises will decrease symptoms such as pressure in your pelvic region, urinary incontinence, urgency frequency, incomplete urination, poor evacuation of the bowels, rectal pressure, fecal incontinence, and even pain with sexual intercourse. In addition, practicing this wedge program will promote better blood flow to the pelvic organs, in turn, healthier vaginal tissue. This program is not recommended if you are pregnant. All you will need is a wedge about 6 to 9 inches in height, preferably firm, but it can be soft, a ball or a pillow that you'll fold in between your knees, and a TheraBand, as well as a blanket or a pillow to support your head. I like to put on the band around your knees and the ball, and you're going to go ahead and position the wedge up against a wall that you don't mind putting your feet on. You're going to carefully position your buttocks, the higher portion of the wedge, and then rotate your body, putting your feet up on the wall. Position the wedge so it fully supports your back. We're going to start by doing some deep breathing. We're going to inhale through your nose, inflate your belly, exhale through your mouth, deflate your belly. After 3 to 5 times of deep breathing, we can now start with our ball squeeze. You're going to slightly rotate your toes inward. You're going to squeeze the ball, pull in your pelvic muscles, and firm your lower abdominals or your transverse abdominis muscle. And we're going to hold for a count of 5. 1, 2, 3, 4, 5. And then release. Again, rotate your toes inward. Squeeze the ball, your pelvic muscles, and the transverse abdominis. 1, 2, 3, 4, 5, and release. You'll repeat that 5 to 10 times. Now to challenge your lower abdominals, let's go ahead and pull your heels off the wall 1 to 2 inches. You're going to repeat that same exercise, rotating your toes in, squeeze the ball, pull in your pelvic floor, your lower abdominals for a count of 1, 2, 3, 4, 5, and release. You'll repeat that exercise 5 to 10 times. If it is too challenging, you can rest your heels back on the wall in between each repetition. The next portion is you're going to slightly turn your toes out. You're going to roll your knees out into the band, pull in your pelvic floor, firm your lower abdominals for a count of 1, 2, 3, 4, 5, and then release. Again, roll your toes out, roll your knees out into the band, pull in your pelvic floor, your lower abdominals, 1, 2, 3, 4, 5, and release. Repeat that 5 to 10 times, and then you're going to pull your heels away from the wall 1 to 2 inches to challenge your lower abdominals. Same thing, roll your toes out, roll your knees into the band, pelvic floor squeeze, lower abdominals firm, 1, 2, 3, 4, 5, and release. Again, roll out with your knees and your toes, squeeze the pelvic floor, your lower abdominals, 1, 2, 3, 4, 5, release. You'll repeat that 5 to 10 times. If it's too challenging, go ahead and rest your heels back onto the wall. in between each repetition. I then want you to complete your exercise program with repeating your deep breathing. Inhale through your nose, inflate your belly, exhale through your mouth, deflate your belly. You're going to now roll off of the wedge carefully. And you've just completed our advanced wedge program. Thank you.